I'm Antoni Chan, consultant rheumatologist from London, United Kingdom, reporting here at ACR22 from Philadelphia. There have been some interesting presentations looking at the aspect of gender differences in axial spondyloarthritis here at ACR22. In particular, how patients may respond to treatment. And here today, I'd like to highlight two which I think are key abstracts looking into this topic. Firstly, abstract 1497, which is a study done in Germany from the Axial database, where they had 3,000 patients recruited, and these patients were patients with axial spondyloarthritis treated with secukinumab. We know from previous data that early treatment and early diagnosis improves long-term clinical outcome. And here they looked at the patient population from this database and found that in patients who had a delay to diagnosis, as in they were diagnosed more than a year from the onset of symptoms, there were gender differences. In females who were diagnosed later, with patients with ankylosing spondylitis, they had a higher body mass index compared to males. They also found that in females who were diagnosed later for more than a year or more with ankylosing spondylitis had reduced treatment effect when they were treated. Although the majority of these patients responded to treatment, it appeared that in females, the treatment response was less compared to males. Both males and females in the study also had very high ACR health index, and the longer the delay to diagnosis, the higher the ACR health index, or the worse functional score. The same was not found in psoriatic arthritis. There was no difference in response to treatment in patients who had later diagnosis compared to the ankylosing spondylitis group. So I think this tells us that there are gender differences which are important for us to consider when we are making the diagnosis and treating our patients with axial spondyloarthritis. The second important abstract, I think, which also highlights this topic on gender differences in the area of axial spondyloarthritis, is from 1614. This is a study done using the PROOF database. PROOF is a study, which is a 5-year study of recently diagnosed patients with axial spondyloarthritis, both non-radiographic and also radiographic XPAR. There were 2,633 patients recruited into the study, and when they've gone back to look and to see whether there were differences in terms of gender, they did find that in the non-radiographic arm, these are patients who have MRI changes but not X-ray changes, there were differences in terms of male and females and how they respond to TNF treatment. The response was better in males compared to females in patients in the non-radiographic arm. In the radiographic arm, or what we know of as ankylosing spondylitis, there seemed to be no difference in terms of the treatment response to TNF inhibitor. So this tells us that there are also gender differences in terms of not just the whole axial spondyloarthritis, but also within the non-radiographic as opposed to the radiographic components. When they adjusted for TNF-alpha use, this was not seen to be related to TNF-alpha use. So these gender differences are appearing to be not TNF dependent, and the research needs to be done in the future to look at what mechanisms might be driving these gender differences in terms of the patient outcomes. And I think this will be another area that we look forward to further reports and publications in the years to come. I'm Antoni Chan, reporting for Room Now here in Philadelphia at ACR22.